Welcome back. What I'd like to do now is talk about PSH therapy and the work that I do, and also a little bit about body psychotherapy. But mainly PSH therapy, because most people, that's what they normally start with, and it's also very popular as well. PSH therapy stands for Private Subconscious Mind Healing. And it was developed, it's still a fairly new therapy. It was developed in the early 90s, at least publicly, by this man, Frank Wright, who unfortunately passed away in 97, but not before he had trained quite a few people to do this work. He was a clinical hypnotherapist back in the early 70s, early 80s, and he found that he was only getting certain results with people with that type of work, with that hypnotherapy work. And like a lot of good things that get stumbled on, a lot of good discoveries, he found that with some people he was getting very good results, and eventually he started to correlate that, started to figure out that, hang on, the people I'm getting the best results with are the people that I'm not digging up anything from the past. So PSH therapy was born from that moment. He developed it further through the 80s with thousands of people, and he also wrote a book on it as well called Emotional Healing, and which is available at bookstores. And he found that at some point he couldn't call his work hypnotherapy anymore because it had developed a lot further. He had changed it quite a bit. Some major principles that were quite different, and it would have been misleading to call it hypnotherapy. So he called it PSH therapy. And each letter of PSH actually stands for one of the major principles of the work. And it's worth mentioning those just so it can make a bit of sense. The P in PSH therapy stands for private. With PSH therapy, the sessions are extremely private. It's a 3-session process. You have 1 session a week or 1 session every 2 weeks, and that's it basically. And then you give it 6 to 8 weeks to see how you're going, how things are shifting, and then you can come back for a 4th session, or we reassess it at that point, whether some body psychotherapy work is necessary or a 4th PSH session. But if things are changing, you normally let it keep happening. Very simple process, 3 sessions, very safe, very gentle, and very, very private. There's no digging up of the past. There's no needing to know why you are the way you are and what caused it and where the problem came from, etc. Very, very private. The goal of PSH therapy is to get to the original emotional cause of whatever symptom you're coming with. There could be a feeling cause, as I mentioned before, limbic brain, or it could be a sensory motor cause, an anxiety or panic. And that's all subconscious. And PSH therapy is very much a subconscious therapy. You don't have to sit there talking about your problems. A lot of people that I've seen have done that, infinitum sort of thing, and it goes round and round their head, and they know it inside out, and they've read millions of books and all that, and they know their problem inside out, but it's still there in the subconscious. So PSH bypasses the conscious mind, helps you relax. You don't have to do anything, think anything during the session. You just relax there, super private. And the more private it is, the more that part of you, the cells in your body, in your nervous system, and the limbic brain and cerebellum can actually start to feel safe. It's almost like creating an incubator effect where that part can start to finally release and let go. So very private, and a lot of people find that very confusing. That they come in and sit down and they don't have to talk about their problems. It's very strange, but that's basically how it works. Because when you're talking about your problems, you're up here in your conscious mind, stuck up there, going round and round, you know it inside out. And again, it is valuable, it's important to some extent, and with some people that I see, that's where we have to do. We have to talk about it because that's the bit that needs to kind of click together. But for a lot of people who have done all that, because it's available all over the place, it's the subconscious side that they need to work on. So it's very, very private. And because it's very private, that original emotional cause in your body, and it could be in a number of places and cells in your body, the nervous system, actually feels safe to release. If there's any sort of suggestion that we have to open up and figure out what's in there, your body will clamp down, defenses come in, clamp down, and nothing budges. And that's what happens with a lot of people who go to a therapist for years and years and years. It all clamps down and nothing budges. So we've got to find ways to make it very, very safe for your body to know that we're not digging up the past. There's a part inside of you that knows exactly why you are the way you are. It's already there. You don't have to know it in detail because your body's doing it, and it's just a matter of giving your body that opportunity to release it itself. And whether you even know what caused the problem is almost incidental for PSH therapy. So that's a very major point and very distinct aspect of this work. Second major principle, which we talked about in the first half, is that it is subconscious. It's very much subconscious, body-based, autonomic nervous system-based, not intellect, conscious mind-based. So in terms of what you actually do in the sessions, you just close your eyes, you relax back. It's like a guided, almost like a guided relaxation to begin with, and then like a guided meditation for the rest of it, the therapy portion of it. And literally you don't have to say anything or do anything. You relax back, close your eyes, and I'm talking the whole time, guiding through your body, through your subconscious, giving your body the chance that it normally doesn't get in normal day-to-day life to finally release that part that never got a chance to release, because you've either suppressed it or you've had to get on with your life and forget about it, and other things have become more dominant. You never gave yourself enough time to actually access that part that really needs to release and resolve. As I mentioned before, that fight-flight response maybe just needs to kind of release and complete something that's just still stuck there. It's an old pattern that needed once. It was important at some stage in your life to survive and get to where you are, but now it's just hanging on baggage, and it needs a chance to release. And PSH is very good for that original emotional cause. It's too vulnerable to open up to help that release and let it go. And sometimes the effect could be very subtle, but that subtle change is very permanent and very, very major. And once that original cause releases, and like a domino effect, everything else just kind of trickles through your body, and over time things begin to change. And certainly we've got a lot of evidence to prove that it certainly does work for a lot of people, especially with the questionnaires that come back, that get mailed out 6 months after the sessions. Third major principle is the H in PSH is the fact that it is you healing. Just a reminder that you're the one healing yourself, not me. You're the one fixing yourself, not me. I'm simply there as a guide to create the right conditions for your subconscious to feel safe enough to release that part that it's never had a chance to finally complete and resolve at the feeling level and at the body level as well. So that's PSH in a nutshell. 3 sessions, sounds very simple, sounds like you're doing nothing, and it can be so simple that it's difficult to do sometimes. And my job is to help you let go of the conscious brain, because that's dominant in our society, and let the other brains, once that relaxes and releases a little bit, then the rest of you can really start to untangle itself and release things at that core organic level in your body that really needs the healing work, not the intellect level which dominates our lives. When people have done the PSH therapy, a lot of times after they've given it 6 to 8 weeks to see how they're going, they need more work. And that normally I then bring in the body psychotherapy work. And for that work, that is excellent, as you'll see the next slide here, excellent for childhood trauma, when you can't feel feelings, when people that have come in and say I just can't feel feelings, or my wife is saying, oh, where are your feelings, sort of thing. And body psychotherapy is very good for that, because it allows for breath, sound, movement. It's a lot more active. It's the opposite of PSH, so they complement each other very well. Also handles when you have the need to express and move, that fight-flight response where your body needs to fight or defend itself. We can actually act that out a lot more, because your body muscles need to have that movement happen. And also, as mentioned earlier, it's also very good for if you know what the traumatic event is in your life. If there was a car accident or some surgery, or even the childhood trauma, it's an actual event that you can remember that happened in your life, that ever since that event you were never the same, then the body psychotherapy work is excellent for that, because then we go through frame by frame the event very gently, very safely, but we're working with your nervous system the whole time, your subconscious, not just the intellect part of it. We don't have to sit there talking about it. We're working through your body. There's hands-on work with it, especially for childhood trauma work, because when that part of you that got traumatized as a child probably needed to hold on, and needed that comfort, needed to grab onto someone. In a body psychotherapy session, that's possible, because the hands-on work is very important. The touch work, especially for a child that needs to grab on, very, very healing, and that sometimes is the resource that the person needs to actually heal that trauma. So the nervous system gets that support, and then it just relaxes and resolves itself. So in summary, how do you know that you need to do more subconscious work? Apart from the symptoms that I mentioned earlier with the limbic brain and the cerebellum, the sensory motor autonomic nervous system symptoms, there are other little signs. if you've read lots of books and still got the problem, you've got too many thoughts in your head, you're tired of talking to solve your problems, you've talked about it to lots of people and it's still there, you know your problem's inside out but it makes little difference, or willpower doesn't work for too long. It works for a little bit but it's just still there. They're very strong signs that your conscious brain's working too much. It's just overrunning itself, trying to do what was meant to be done by your subconscious. So that's it. It's been a very short presentation. Hope you've enjoyed it. This presentation on healing your subconscious. And my name is George Gintilas. If you'd like to see me for a private consultation, feel free to ring on 03 9525 7680. Or you can also go to the website www.relaxedmind.com for a lot more information, articles and testimonials. Thank you.
Hello again.